right, let us go ahead and get started and open up in prayer. Attention, prayer. In the name of Allah, the Beneficent, the Merciful, surely I am being turned to thee, O Allah, striving to be upright to him who originated the heavens and the earth, and I am not of the polytheists. Surely my prayer and my sacrifices, my life and my death are all for Allah, the Lord of the world. No associate has he. This am I commanded, and I am of those who submit. O Allah, thou art the King. There is no God but thee. Thou art my Lord, and I am thy servant. I have been greatly unjust to myself, and I confess of my fault. So grant me protection against all of my faults, for none grants protection against faults but thee. And guide me to the best of morals, for none guides to the best of morals but thee. And turn away from me the evil and indecent morals, for none can turn away the evil and indecent morals but thee. O Allah, make Muhammad successful and make the true followers of Muhammad successful, as thou did make Abraham and the true followers of Abraham successful. Surely thou art praised and magnified. O Allah, bless Muhammad and bless the true followers of Muhammad, as thou did bless Abraham and the true followers of Abraham. Surely thou art praised and magnified. Ameen. Assalamu alaikum, family. I pray everyone is well. In the holy name of Allah, the Beneficent, the Merciful, I bear witness that there is no God but Allah, and I bear witness that Muhammad is his messenger. I greet you all once more in our greeting words of peace and paradise in our original tongue of Arabic. Assalamu alaikum. We have two powerful guests with us here today. I'm very excited about this one. Welcome to the Master Call. This is part 2 of our How to Eat to Live Q&A. Part 2 will be dealing with women's health. So any questions that the family has for our sister, Dr. Safiyya Shabazz, or brother, Dr. Akili Muhammad, you may ask them both questions by sending them directly to our sister, Shahida Muhammad. You can directly message her and she will get them over to our dear sister, Anita, who will be doing the questioning today. Since today is Women's Health, I know y'all don't want to see me. I was here for Men's Health. We don't want to see me today. We want to see Sister Anita. But I asked our dear sister if I could just open us up just to thank you all, brother Dr. Akili Muhammad, sister Dr. Safiyya Shabazz, for joining us and giving us your time. I'm personally very excited about this, as we all are. You both are like celebrities to me. You know what I'm saying? I love the people who are doing the work of God in the way that you two are doing. Those are the type of people that I see as the celebrities, not the people we see as celebrities in this world. So I'm very happy, and I'm going to hide my excitement to see you both up here, having you both at the same time. This is very powerful, and I look forward to the conversation that comes from it. So without further delay, do either of you want to open up with any words to get us started? Anything you would like to say? We can start off with you, Sister Dr. Safiyya. If you have anything you would like to say before we get started with the questions, ma'am.
Well, I not in particular, but I am always very appreciative of people like yourself and all of those who are involved in organizing these types of information sharing events. And, we really are very blessed to have access to information that is power. They say our people are destroyed for lack of knowledge, but we have access to knowledge. And so much of it is very simple to implement. And I've been blessed to be able to maybe go deeper in terms of certain health aspects. And there are so many things that, despite um, the best implementation of what we know as far as the teachings, even under the best circumstances, there are things that are outside of our control that we may experience. And so being able to navigate those various aspects is a blessing, but most of it is something that is like we have equality in that way. We have access to the same teachings, same information, and most of the difference is implementation. So
Beautiful, beautiful opening words. Thank you for that, dear sister. Brother Dr. Akili, did you have anything before we get started, sir?
Yes, sir. I have a couple of things, and inshallah, I'll be as short as possible. First, I'd like to just
Yes, sir.
respond to that celebrity thing. I think I'm humbled by you saying it. It's to some degree embarrassed, right? Just to be 100%. But I think whatever you all see in me and Sister Dr. Safiyya, we have to all know that we have a gift, we have a talent, we have a blessing as well. So all of us are, that word celebrity in whatever we are great or growing into great being. And yeah, I just wanted to say that because that didn't
Okay.
it didn't
Well,
go over
if we
well with me,
get
my
there on the
brother.
Okay.
week
Not that I'm
and
upset at saying it,
I
but
have a few days
I,
off, then I will.
I
There
grew
we
up in
go.
Southern California, and my parents used to always talk to us about, just because this person's on TV and this person's a professional athlete and this person's in music, don't necessarily make them good people. So that was never something that I took, that I wanted to be a celebrity at all. But my second point is I just want to talk about my sister for a minute. Sister Doc from the top of the clock, because she and I met approximately 2009, 2010. I don't remember which one, but we met at Savior's Day. And ever since then, we've had many, many hours of, Zoom calls, telephone calls, interactions, supporting each other, wrangle. We're scientists, so we don't always agree 100%. We wrangle, we agree, but um, from my vantage point, I think she would agree, we've grown to really respect each other, really honor each other, and really know that, not being a doctor from another avenue, right? Because I don't really think that we have like some lock and sew thing on doctor, but we did go the traditional way that people call people doctors. And if you all don't know Sister Dr. Sophia's story, I'm not going to go into it. It would be her business to tell you where to go or to tell you the story. But I do know that ever since I've known her, I know she's a patient advocate. She is somebody that puts herself on the line for the people that she cares for. And I'm saying this because it's not common. She has many colleagues that she went to school, people she interacts with. I have. Most of doctors, in my personal viewpoint, are cowards. They wouldn't jeopardize or sacrifice their career, their money, their prestige, their social status. They don't they just don't have that in their mind. And we have a sister with us tonight who has done that, did it in the pandemic because she cared enough for her people to stand 10 toes down. And I think that's why we admire each other, because we see a lot of each other in ourselves, but we're also different enough that that's why Allah brought us together. And so I just wanted to mention that because it's Sisters Day, right? And my suggestion many years ago, and my suggestion would be today, sisters, if you don't and haven't done enough research in the medical field to know that there are many, many, many Zionists as chief executive operators of hospitals. There are many that are administrators in hospitals. There are many physicians in this country that are Zionists. And so when we look at what's happening to our Palestinian brothers and sisters over across the water, that is sometimes who you possibly put your hands into, your life into their hands, should I say. And to me, if you live in um, Canada, Brazil, Mexico City, it would be worth, and anywhere else, it would be worth for you to spend money like you go on vacations or you spend money on all the things to make sure you're in the hands of somebody that has proven that they're going to care for you, look out for you, and take care of you at a high degree. And so I just wanted to mention that because it's Sisters Day. It's hard to find good doctors out here. Believe me, we know because we're in the field. We hear the conversations that happen behind the closed doors. And excuse me for expressing like this, but you all know I gotta be me. Is these niggas ain't worth the money that you pay them, and they're not looking to take care of you. They're looking to put you in a protocol and get paid the best they can, and after that, they on their way. So honor and understand who you have in your midst tonight, sisters, as far as getting your care. If a woman has to put her hands on you, you need to be in a building, in a facility with a person that's going to do that with high respect, high regard, and treat you like God would treat you.
Praise be to Allah. Thank you. And we have mutual respect as colleagues. You, like he was saying, you don't know, we have the people out front, but we got an army, a scientific army, um, working on your behalf and working together. So praise be to Allah for that.
All praise is due to Allah. Beautiful. Well, let's get women's health started. How do you to live part 2? I'm gonna fade to the back now and let Sister Anissa handle things. Thank you for wearing that great hat, Sister Anissa. We didn't plan this. We just in tune and coordinated like that. Looking good. Praise be to Allah. Assalamu alaikum.
Walaikum salam, praise you to Allah. Funny story is, it was going to be a drape scarf, but the hair wasn't doing what it's supposed to do. We got to think fast, friends. What can I put on my head? The tam is always a winner. All praise due to Allah. Thank you so much, Brother Demetrius, for opening us up. Thank you, Dr. Akili, and thank you, Dr. Safiyya, for joining us. This is absolutely fantastic. I believe this is Dr. Safiyya's first time coming on a master call, and last week was Dr. Akili's first time coming on. So this is our third time circling back into How to Eat to Live, book 1 and 2. So it's only right that we've had pretty much everybody else come on. We had to have y'all come on as our beloved of many doctors in our nation, but our beloved doctors. And Dr. Akili gonna take the compliment. One of these compliments is gonna stick, and you're gonna take it, and you're just gonna digest it and hold it, okay? Praise be to Allah. All right, so we're gonna get into questions. We already have a laundry list that I know we're not gonna get all through today.
It's a perfect compliment because I noticed that Dr. Keeley, he'll know line and page, etc. I got a lot of little informational tidbits floating around in my head, and I, um, I can't always call the reference, but I try to point that out if I'm unsure of where it may have come from. And there are things that I tried to find a reference for that I was raised in that I'm pretty sure it's true, but I sometimes I might struggle to find the exact reference because I had um, a blessing in growing up in a household with someone who sat at the foot of the most honorable Elijah Muhammad. So there might be little tidbits that are floating around in my head, but I couldn't prove it. So you could reference, somewhere for you to go. Exactly.
Yes, ma'am. Totally understand. Understood. So our first question is, what would be an adequate meal for someone who lives in a high toxicity environment like cities or high stress jobs? Food that would be considered cleansing or detoxifying without falling into the white man's business tactics around detoxes.
I think that this is I would say to follow like the keep it simple principle. Keep it simple, sister principle, because I think many times there are a lot of things that could be augmentative or complementary to the basics that we have. But as I'm sure you've all heard before, this is like the fourth or fifth or eighth call you've had regarding how to eat to live. The best thing that I know of as far as detoxifying is what the most honorable Elijah Muhammad said is better than, all the pills into one bottle or a billion bottles, and that is fasting. And so that's what I would say would be the go-to. And some other things that we also know from How to Eat to Live are that milk and bread are our best foods, and he, would want us to have the navy bean, which was used historically. I don't know if this is actually in How to Eat to Live, and you can jump in, Dr. Keeley, in terms of why it became named the navy bean to help protect against radiation and such. I don't know if that was something that came directly out of How to Eat to Live or elsewhere, but very simple. I'm someone that likes food. I like a variety of foods. There are some people that would be satisfied with just eating chicken and rice every day. But I like, different flavors on my tongue.
Mhm.
Give me a buffet with all different things, and I'm excited about it. But that really is not our way or the suggestion of the Most Honorable Elijah Muhammad. He said you don't need a lot of different things to eat. A lot of different variety in our diets. We like it, but that's not really what we need. I would say that where the variety can come in positively is that there are sources of foods where they may be more or less reliable for avoiding toxins. And if you mix it up, then you're not always getting from, that one source. And since we're always operating under a certain level of uncertainty, kind of mixing that up might, spread the odds around that you're taking in toxins. So that's what I would say. I think most of us don't need it. We don't need a lot of carbohydrates and sweets. You could
Mhm.
really go without it completely, and a lot of us really could do better with that. But lean proteins, whether that's just the bean, or if you want to have fish, or chicken or whatever, and the vegetables, and most of our food should be cooked under steam. Like that's what's recommended. And again, these are things that might not be how I prefer. I love a roasted broccoli, for instance, but steamed broccoli is more in line with how the Most Honorable Elijah Muhammad suggested that we prepare our foods.
Very good. Yes, ma'am. Thank you,
Yes, ma'am. I
Dr.
think
Akili.
you pretty much gave the same thing that I would have said. I just am going to get a page, and I was like you said, I got I'm trying to make sure our brothers and sisters have the pages to go look these statements up to know that we are basing what we say in Elijah Muhammad. And again, I'm asking for you all's permission because I think it's rude not to look in the camera, but I'm trying to find these pages, so I pray that you all give me a pass.
Yes,
But
sir.
that's page 141 on page book two, where he says milk and bread are our best foods. He says it other places, and he also says in other places that milk, bread, and navy beans are the best of foods. And so, my suggestion always to people that live in toxic big cities is to concentrate on milk and bread. But milk and the navy beans are the foods that I know of that do a lot of pulling toxins out of the body.
Mhm.
And he doesn't necessarily tell the story, Sister Sophia, exactly what, but there are other, writings in some of the table talks where he talks specifically about that. It was the Navy that actually started feeding their soldiers the Navy bean to extract the um, radiation out of them. And it was, of course, tested highly when they were in the area of Japan where Nagasaki and Hiroshima had been bombed. And
Yes.
the men were pretty clean compared to what they thought they would be. And of course, very clean compared to the people in Japan. And I'm forgetting where the actual suggestion came from, but they got it from some indigenous people, is where it originally came from. So that would be our suggestion. And again, just to ride along with Sister Dr. Sophia, when I first started my transition from one meal a day to one meal every other day, I would just do the 3-day fast with the believers and start a day early and end a day late, just
Mhm.
to increase my fasting days. So that's the other way that you can do it. Concentrate on the milk, concentrate on the navy beans, make sure that's a stable in your diet, and then start adding fasting days. And lastly, start working here and knowing that there is no information that's going to get you better health than the book that has From God in Person on the top. Grow your faith by trusting them and doing what they say, and then watch it prove itself.
Praise be to Allah. Thank you. Thank you. Very good. Our next question is, based on your experience, what are the root causes of acne in women, and which specific foods should we incorporate into our diets to support clearer, healthier skin?
Back to me.
Yeah.
In my experience, I really couldn't reliably say that it's certain foods are correlated to acne. Is more um, hormonal and metabolic for people. And there are people who have a terrible
Mm,
diet and clear skin, and people who have a good diet and bad skin. So it's not always a one-to-one correlation, although inflammatory foods, which for most people, the number one inflammatory food for us to overcome is sugar, and things that are easily converted to sugar. Um, that that's really my honest answer to that. And I think most of the people, and there are people who they think they're doing great with their diet, and if you really followed them around, they're not doing such a great job.
mm,
But uh there were certain people where their metabolism or their hormones are like pro, especially for women, like pro androgenic. So when we talk about conditions like polycystic ovarian syndrome, where um some of the characteristic things are like acne, hirsutism, which is like hair growth in places that might usually be more associated with men, irregular menstrual cycles, that type of thing, is sort of like a imbalance of hormones that can sometimes be hard to detect with lab work, but you're seeing like a more predominance of like male hormones, and the estrogen and testosterone get converted, back and forth between the two, and both men and women have both. Um, but it's more on that hormonal side, I would say, than dietary. Although you might find that when women dramatically, uh, well, not even dramatically, let's say like 5 to 10% reduction in their weight, they might experience an improvement in things like the regularity of the menstrual cycles and things like that, where that can improve that condition, but not a specific food. I wouldn't say.
mm.
Do you
Thank
have
you.
anything to add, Dr. Keely?
Yeah, well, I agree with everything you said. I mean, I have seen the same variability, right? I know some people that eat terrible, skin clean, some people that are trying to do right and have horrible acne. So it's not really an exact science, but I remember my first low testosterone female patient I had.
Mm,
I gave her a shot of testosterone, and she came back a couple of weeks later with acne everywhere. So we know there's a hormonal aspect to it, but it's not as streamlined as a lot of people may think. But what I will say is that some research that I did years ago on countries that haven't taken on the Western diet, they don't even know what acne is. So it's definitely
mm,
related to food, but how that food affects people is different, of course, because many of the processed foods have these androgenic and estrogenic effects, right? So it's very difficult to figure those things out. But if you were to ask me what foods would I suggest to solve the problem, make your grocery list out of how to eat to live, because like I talked about last week, the ORAC values of the foods that the Honorable Elijah Muhammad mentions in How to Eat to Live are at the top of the list. And the type of foods that the Honorable Elijah Muhammad lists in How to Eat to Live, if you go to just about any other so-called health guru and the
mm,
foods that they suggest when people are overcoming diseases, you'll find most of those in How to Eat to Live. So stick with the foods in the book, no matter what your condition is, and I believe you will see some improvement. And then lastly, I'll say, like everything else, sometimes it takes you experimenting. You'll have to think about what foods may have more of an effect on hormones versus ones that are more toxin cleansing and more proteinaceous, more, things that don't have the possibility of affecting your hormones, and just see which ones do you well, which ones may exacerbate your acne. And, that to me, that's always the best thing for us to do is to experiment with ourselves. And when we see something, we know what it is. And then you'll never have to worry about that again being a problem that you can't solve.
Very good. Thank you. I do want to testify very quickly to the power of how to eat to live as it pertains to acne. Um, I used to have, which wasn't something that I had like even from teenagers, I had excessive adult acne. Like when I hit about 21, 22, I looked at my face and I was like, this isn't my face. And it was bad. After the call, I actually posted a picture maybe in my Instagram story, because it had got really bad, like all over my forehead, around my cheeks and everything. And it was around the time I was diagnosed with fibroids. So the hormones are all over the place. It was really bad. And I was also crazy. So when I stopped being crazy and when I started eating better, my acne just fell off my face. It was great. So it's a good
And stress,
testament again.
that reminds me as well how stress really, it can actually have a significant impact on the skin. People with chronic hives can develop chronic hives related to stress. And I personally experienced something similar to what you described with acne, where I remember when I was in residency at Morehouse School of Medicine, Morehouse Family Medicine, and I, was going through some personal challenges, and I came to work, and one of the other residents said, Shabazz, what happened to your face? And I mean, I had some level of acne as a teen, but I had never had, my face was never that bad. And, when I kind of made some decisions about my life, it started clearing up. And so the skin, I think in the embryologic development, it is part of the nervous system. I think that's where it comes from. We know, particularly like melanin, that is, kind of those cells are from the nervous system, where it is very linked, skin symptoms and your emotional health.
Very good. Thank you
You
so
brought
much.
something. Can I make one more comment?
Absolutely.
So I wanted to mention, because it came to my mind, about a lot of skincare products that we use, right? Many of the skincare products on the market, the more common ones, have many alcohols and alcohol type chemicals in them, which are drying the skin. And that's why, most of the time you see doing this all day, right? If it was moisturizing your lips, why would you have to do it all day? Same thing with lotion. But the other thing about these type of products that many women are using on their face is that the list of ingredients is so long, and you probably don't even know how to pronounce many of them. Many of those substances are gender bending, what we call them, right? So they alter and they add to, everything that we're mentioning to cause hormonal problems. And the skin is tied to many different systems: the hormonal system, the nervous system, the endocrine system, the lymph system. You see what I mean? So the skin is involved in so many different systems that when things start to go wrong with the skin, it can be sometimes difficult to figure out. But that's why I made the comment I made earlier, which you co-signed, Sister Anissa, is that the Honorable Elijah Muhammad's wisdom is so much greater than all of these other quacks and would-be doctors and wannabe doctors, as he said, put together, that no matter what you are going through, going back and trying to get yourself submitted to and disciplined in how to eat to live will probably improve whatever you're going through. And then I'll say this last. Somebody reached out to me not long ago, and they had a issue with their heart. And of course, they were extremely worried. and so was their family members, right? And my point to them when they reached back out to me was, hey, look, this is what I've been doing now for 21 years. I have a confidence in how to eat to live that no matter what you come to me with, I'm going there as a foundation. And if your confidence, your faith level is not there, this is no competition. And if you feel more comfortable, and I think this is important for myself and Dr. Safiyya to express to you all, is that we make decisions based on actual facts. We're not like no super people, right? Just the same way we came into the Nation of Islam, and Honorable Elijah Muhammad, let me take it back. Master Farah Muhammad and Honorable Elijah Muhammad have given us a list of things that we have to learn to put Islam as a Black person in America in the proper context. Well, that's the same thing that we do. When you fill out your form, when we ask you certain questions, we look at your lab work, we look at what you've been through, and then we start to come up with the ideas of where we're going, right? So if you walk in my office and you smoke and you've been drinking all your life and you're overweight and you smoke and you don't exercise, you don't drink enough water, but you still look pretty good, I'm putting your behind through every damn test on the planet because I know your actions are telling me that you're going to run off a cliff or run into a wall. But if you come and you're trying to do good things, you walk on a regular basis, you do hydrate yourself, you do try to eat right most of the time, you can go through a ebb and flow of, okay, you might not need this, but you may need this over here. And, that is a reality of what it is that we do every day when people reach out to us. And so it's not magic. There is science behind it. I would say that both of us being Muslims and members of the Nation of Islam, Allah is at the head of what we do always. And so at the end of the day, this is a lifestyle we're talking about that takes faith. Because if you're outside of practicing this as best you can, there are consequences coming living an American lifestyle. And when the consequences come and you don't have confidence in what you say you believe, it's going to show itself every time. I'm not saying any of this to put anybody down. I'm saying this from our perspective that we have to look at you and start to work with you and help you in the ways that you are able to, and not trying to paint a rosy picture and then lose you in 5 to 10 years. So I just wanted to paint that picture from that perspective.
Thank you so much. I'm about to drop a very shameless plug while we're talking about skin. Sister Nafisa Muhammad, she has skincare. It's called Nora Skincare. I've been using it for a couple weeks. It's fantastic. It don't have the laundry list of ingredients the way Dr. Akili was talking about. It's absolutely fantastic, and it's from our dear sister Nation of Islam. Her stuff drops September 1st, I believe. And there is the link that you could go to right there. It's a Google Doc link. Scroll down a little bit, and then you're going to see the actual skincare joint. Has navy bean, this scrub thing, almost like a navy bean scrub mask. Oh my God, y'all have never lived until you had it on your face. So please
Shout out
go
to Sister
ahead.
Nafisa. Congratulations, sister. As soon as it comes out, meanwhile, I'm gonna be helping support it for real, for real.
It's fantastic.
Yes,
And then our next question. I done lost her name. Sister Shahida, where are you? Here we go. Okay. What should women do if they feel they started to lose their hair after a certain age? And I'm going to caveat that with, I think that's the proper word I'm using. I'm going to add on to that. If you've also just had a baby like me, and the hair that be wanting to go but not come back, if y'all could just do the elderly side of it, where the sister is maybe reaching a certain age in maturity where her hair is starting to fall out, but also the postpartum for us girlies, please. And very much thank you. Sisters, yeah.
This is a challenging one, and I would say, like, medically speaking, I can't say that I know for sure like something um, from How to Eat to Live regarding your hair, per se. My dad used to tell us, oh, if we eat wheat germ on our cereal, somehow that's gonna make our hair grow. So I'd be sprinkling that wheat germ on my cereal because I wanted long hair. But that's not from How to Eat to Live. And there are people that have taken or sold different nutritional supplements that are supposed to support hair, skin, and nail growth, which may be helpful. But what I did the wheat germ work though?
That's my question.
You know what? You know when my hair grew all down my back is when I started covering it every day.
Man.
When I started covering it every day, and not manipulating it a lot. And I've always kind of, because I've had, just like my daughter, she's 17 and has quite a few gray hairs. I've colored my hair for a long time, but that's when it grew all down my back and keeping it covered. And so, yeah, that's all I can say about that. But I think most of the hair loss that I see that we can change is traction related. We're wearing our hair in styles that are putting too much tension on the follicle. And that tension causes inflammation. And then the inflammation causes scarring, and that can lead to permanent hair loss. So, sometimes you might need like you just going to the medical world. It's not How to Eat to Live. You might need to see a dermatologist, but sometimes like even steroids on the scalp to help calm that inflammation. But if we can avoid these high tension hairstyles, and sometimes even our wearing of scarves is putting tension on our edges where we're kind of inadvertently pulling our hair out around the edge, or if we're braiding a lot, or even you see people with these lock styles and they're pulling it so tight that it's causing scarring. And then there are hormonal forms of hair loss that women can get. They can experience a type of male pattern baldness. There's a condition, CCCA, which they're finding some of these forms of hair loss are responsive to some of the same treatments as diabetes. So again, would How to Eat to Live help diabetes? Absolutely. So with some of those same dietary patterns, maybe reduce your symptoms or minimize them? I would think so, but it hasn't been directly studied. But um, if you're really experiencing significant hair loss, you might want to see a dermatologist. But even dermatologists, I've learned they get it, stressed having women come who are experiencing hair loss because sometimes it's very difficult to treat, and it's such an emotional factor for us that it can be hard to really properly address it. So like it's an emotional thing for us as women, our hair, and when we start losing it. So seek professional help. But yes, if we're doing the maximum we can as far as the lifestyle, it can help. But also like manipulate. And there are people that have nervous condition. They're sitting there, doing things and pulling at their hair. And that's a nervous condition. You could get alopecia areata, which I experienced that before, where I just had a big old bald spot right here from stress. It was from stress. And I went and I had to get a steroid injected. It only took one treatment, and it took care of it, but it was directly stress related. So,
Well, I only have something very short to add. There is a genetic component to it as well, right? My father was bald by the time he was in his early 20s, and both of my brothers have the ability to grow full heads of hair. And you're listening to a brother that's been striving on how to live the best he could, had his own concoctions, and I'm still bald, so I'm going back on mute.
and there are women. So, like the male pattern baldness gene, from what I understand, is what we call X-linked. So that would be on the X chromosome. All men and women, we all have X chromosomes, and only men have Y chromosomes. So, um, if you are a woman who happened to get two copies of this X chromosome that has the balding
Mm.
gene, then you may experience that same, what we call male pattern baldness. So
Very good.
some of
Thanks,
it,
Luce.
but I don't think that's the majority of hair loss in women, though. That is the majority in men, and I swear they're doing something because I mean, most men, it seems like it's the majority of men who may be starting in their late 20s or 30s, start to lose their hair. So I don't know if that's something that is environmental that's contributing to that as well.
I'm really cracking right now inside of my body. I'm trying to keep my composure because my husband's over here laughing too. And when he gets to laughing, it just never works out well for me. So, and my daddy bald. He started balding when he was 5. It's just all too funny at this point. So, thank y'all for that laugh. I really do appreciate that. All right. What the minister say? Just a little levity. So, our next question is. What is a good, healthy food or drink to boost your metabolism as you get older?
Do you really want to boost your metabolism, though? This is something that we're
Ooh.
so used to hearing this term about boosting your metabolism, but most of the longevity research, and even like with fasting, what does fasting do? It slows down your metabolism, putting less miles on your body. So I would want to know, what exactly are you trying to do when you say boost your metabolism?
You just cracked the atom for me. I never even thought of that.
And I would also add that it's a big misconception in the public as well as in the medical field that metabolism is mostly affected by what we eat, and it's not. It's mostly affected by your activity level. Most of it.
Mm.
It's what the body does every day, what the body is moving, how much the body is heating up and cooling. All the different things is what mostly is contributing to metabolism. Yes, eating is part of it, but most of it is activity. So
Mm.
I would agree with Sister Dr. Safiyya that it's a difficult question to answer because we will really need to know what is your desire, what are you attempting to do? Because I mean, right off the top, my answer would be I don't have an answer for that because I don't. There would be nothing that I would suggest to a person to drink if they're trying to affect their metabolism.
Mm. Very
And
good.
I mean, because even like when like if you look at the longevity research, there's certain what they call them biomarkers, because it can be hard to really um, come up with short-term answers for things like, okay, what behaviors or foods or whatever are associated with longer life, which that is what the Most Honorable Elijah Muhammad promised us with following How to Eat to Live, is a longer life, extending our lifespan, our health span, and not necessarily weight loss, which he said you should lose weight if you're overweight, or he doesn't use the term obese, but if you're heavy and you need to lose, and you start eating one meal a day, or every other day, and eating the types of foods and eating in the manner that he described, you should lose weight. You probably will lose weight, but that really wasn't the main factor. So I think sometimes we talk about metabolism in terms of weight loss. But if you look at the biomarkers for longevity, they really are those associated with a slower metabolism. So, lower body temperature, for instance,
Mm.
that is associated with lower or slower metabolism. So, yeah. What people really want is to manage their weight, because that's a different question.
Very good. I'm gonna ask this. This is not in the thing, but this is to that question. Um, Say the person is coming to you and they're saying, I would like to boost my metabolism as they perceive for weight loss. And then when you look at them, and I know a specific sister, so hopefully she's on here, and this question may help her, who doesn't eat much, like not eating 2, 3, 4, 5 meals a day, not that at all. Pretty much one meal a day. And even that one meal may not be, it's not like a full situation. It's like a regular sized meal and still struggling with weight. Um, what may be something that they could do if they're saying, I'm not having an eating issue, but I am obese?
Before I answer that, can I give a couple pages on the living long section? Okay, so I'm in book 2. First quote is page 161. The Honorable Elijah Muhammad on the second paragraph says, as you know, as I have repeatedly written in this book, that Allah God taught me, one meal a day of the right food will allow us to live a great long while, even to 140 years and more. Now, notice he didn't say at what age to start. He just told you you're going to live to 140. And if we eat it once every other day and every 3 days instead of one meal every day. And then further in book 2, he says on page 176, third paragraph, the less you eat, the longer you live. So see, that statement right there destroys most of the typical world workout talk about how you eat in order to improve your metabolism. The less you eat, the longer you live. You can eat once every 2 days. You will live that much longer. If you eat one meal a day from the cradle, you should live 300 years or more. Now, remember in book 1, he said 240. Now he's saying 300. Long life compared to what we see, right? 300 years or more, for you will not be sick. Now, listen to this statement. And this is what I was talking about earlier about faith. See, sometimes we have to be these monikers and these things that we've been growing up hearing and things that are part of society's so-called norms, we have to drive that out of us. Allah, God, who came in the person of Master Farad Muhammad, to whom praises are due forever, assured, the word assured is a capital A, assured me of this. So, brothers and sisters, I'm not saying anything particular to the person that asked the question. I'm just talking about in general, sometimes the type of information that flows through society many times are lies.
Thank you.
And I'm someone that I'm not a naturopath. I do use a number of different interventions in my practice of medicine. It included medications to help some people with managing their weight, and there are effective medicines. All medicines have potential side effects. Do all people experience all the potential side effects? No. But we know that for the most part, you will experience the uh, after effects or consequences of a persistent chronic state or condition that's not addressed with whatever it is that you're doing. So that's true for high blood pressure. That's true for obesity. So, it's difficult to give individual advice to a general audience. But really, and this is sometimes I try to make sure that I am, like they say in Dianetics, like you have to let someone be right enough so that they can let you be right. Where I'm not going to say that, without following someone around and tracking everything that goes in their mouth, that they're overeating. But part of the wonder of these newer medications like terzepatide, which is what is the active ingredient that's in Mounjaro or Zepbound, which I have found to be extremely effective to help people lose weight. It does have some metabolic effects, but the main thing it does is to dramatically dial down your urge to eat, snack, etc., and dramatically decrease your capacity for how much you can eat in a sitting. So ultimately, the main part of how it's working is because it's making you eat less. So I hear this all the time where people are saying, I hardly eat, but it is mathematically impossible to maintain cells, a certain number of cells in your body, which you have, if you, for instance, are 250 pounds, it takes a certain amount of food energy, food or drink energy to maintain all of the cells that are on the 250-pound body. That's the math of it. Now, there are some fine-tuned things in terms of metabolism and, when we get into the sugars, et cetera, and maybe triggering ketosis where you can kind of shift your body to try to burn fat. But there's the major component of it is that if you're consuming more energy in the form of food and drink than what your body is burning, then you are going to gain. If you are consuming enough to keep everything level, you're going to stay the same. And in order to start to lose, you have to create a shift. And it's impossible to do that with exercise alone. For most people, the amount you would need to exercise to do that is a lot. And I have personally had times where I will pick up 10 pounds and things like that. And it's so easy to gain and so hard to lose. But I know why it happens. For me, it's snacking. I know I'm supposed to eat one meal a day, but I enjoy food. It's like, dang, we don't get nothing else but eating. So I do it sometimes, even when I know better. Um, so that I think sometimes we have to be honest with ourselves, and sometimes you might not even notice that you're doing it. Um, but if, kind of like when you see the extreme cases, like the my 600-pound life, and they all say the same thing, I hardly eat. And then they show the camera following them around and they're sitting there eat a whole pizza and they say, I hardly ate anything, you know. So yeah,
Yeah,
that's
I
not a
was going to
personal
say,
attack. It's
right.
just
Yeah. Yeah. I
that's
mean,
what you do.
that's what I want to do. I want to speak to anybody that's on the call or that may hear in the future to your mental health. A big aspect that I have seen in every overweight and obese person that I've ever worked with is that the world has beat you down. And when you look in the mirror, you don't have much love for what you see. So any person that's overweight, I would say start with working on yourself because there is an exact science. That doesn't mean it's exact in every person exactly the same, but there's an exact science to how you gain a pound, and that exact opposite is how you lose a pound. And most people, that's not true. I will say all people that I work with that are overweight or obese and they want to come to me to start working on losing weight, the first thing I say is we're not going to talk about your weight because that's what everybody else has talked to you about. And that's what everybody else hasn't taken the time to prioritize you to get in depth enough to be able to help you. Because yes, I'm just going to be 100%, right? Most people that are overweight and obese that I've worked with that say, I really don't eat too much. Yeah, well, that's your defense mechanism. Because once we get into working and looking exactly, then that person usually said, damn, I didn't know I ate that much. That's been my experience. Again, not putting anybody down. I'm just talking about the reality of sometimes how we view ourselves and how much we pay attention to ourselves. When I ask people to do food diaries or energy diaries or different type of diaries, the first thing that people say when they come back is, damn, I didn't know it was like that. That's why we did it. Because it's not about looking at how much you weigh on that scale. I don't even weigh people when they come to my office. I've had patients as much as 500 pounds before doing weight loss surgery. I never weighed them. I didn't know how much they weighed until they came back from the surgery because I refuse to put you on a scale so I can add to all the madness that you've heard all your life or however long you've been obese. Sometimes, as physicians, we have to take an approach that makes the person understand that I'm different, I care, I'm going to show you some love, even though you might not like everything that I say. You might not like everything that I ask you to do. But what you do have is a person that's going to lockstep with you until you get this figured out. And there's no telling how long that's going to take. But we are going to talk about your mental health first. We're going to start working on your mental health first before I ever tell you anything to do, because we're going to start trying helping you lose weight. That is the symptom. It's not the cause.
Very good. Thank you. Thank you. So now we're getting into a question about fasting and pregnancy and or postpartum. So A sister asked, my question is, what are your thoughts on sisters in childbearing ages, fasting every other day or 5+ days, etc.? I'm going to add that with another question that a sister asked. She is in postpartum stage. She is breastfeeding, and her weight is she's had 2 children, so her weight has upped naturally. But she wants to get back down to her pre-baby weight, I'm assuming. And she is currently eating, I think she said 2 to 3 meals a day. And she wants to know, while she's breastfeeding, is she able to go back down to 1 meal a day? And is she able to fast while breastfeeding?
I think that some of these decisions are, personal ones. You have to go. You do have a higher caloric requirement while breastfeeding than you do while pregnant. That being said, you if you are maintaining your I just delivered a baby weight, then you probably are consuming more than what you really need to. But breastfeeding makes you voraciously hungry. It does. Um, Most of what you need is fluids, and in a high resource environment like most of us are here in the United States, I don't think we need to be worried so much, most of us, about eating enough, but really trying to temper the drive that I personally experienced it, where you're just really, really hungry when you are sustaining the life of another human being while nursing. But like, even you may feel that way while pregnant, and we say maybe like 25 to 35 pounds is a healthy amount of weight gain for someone pregnant, or would be, adequate or sufficient. But someone might gain 50 pounds because their appetite called them to 50 to 70 or 80 pounds, um, when all of that wasn't necessary for the life that they were developing. And it just creates more problem. It increases our risk of pregnancy, of delivery, and each of that in between pregnancy gain, when we don't come back to baseline, then it makes our risk for the subsequent pregnancy even more. So it really is important to approach it like it's true. It's understandable when you're, having children, you are picking up weight, but that is not without a price to pay. When we don't manage ourselves, and to get back to our pre-pregnancy weight, we're really taking on more risks. So now we're older the next time we see, and we're heavier. So the risk, they've looked at this, it increases our risk, and it is part of what has the um, maternal child, mortality rates among Black women to be the same as third world countries. This is a part of it. A lot of that is under our control. We are subject to racism, etc., but a lot of those factors are under our control, and that's one of them. So I forget what the original question is, but um, I empathize with the person who is really struggling to get back to their pre-pregnancy weight while nursing, because it's difficult. I've experienced that. But it's still important to regulate yourself, and do some tracking. And you have to hydrate. I think it's safe to fast. I think there might be I don't know if there's some, in terms of like Islamic rules about it, or different. I don't think someone should fast while actually pregnant. Um, but yeah, I got lost in the question talking, so hopefully that's
Yeah, so
adequate answer.
I'll add my point and then I'll find the page. But the Honorable Elijah Muhammad does speak about eating 1 meal every other day and fasting during pregnancy and breastfeeding. I'll find it once I finish this. But I would like to add a different perspective. Sisters, the the process of a woman producing a baby And then breastfeeding, as the Quran says, to 2 years is an extremely, extremely difficult process. There is nothing minimal about what a woman's body is going through. And that's why I can't remember the lecture, but I'm sure some of you remember when the minister talked about sisters that are having babies back to back to back to back. And he said something to the fact, I'm paraphrasing, get a sister a break, brother. You're going to tear her body apart. He said something to that effect because it is a lot of work. And the thing that, again, this is not personal to the person that asked the question. I'm talking in general, right? I'm not trying to attack any person. I'm trying to attack a thought process that I think has to be massaged and maybe altered somewhat. But if your concern is about losing weight, if you were to come to me, I would say you're concentrating on the wrong thing. The concentration should be studying how to eat to live and making sure that what you are putting in your body is going to feed that baby to the optimal reality. And then your great thinking and your great processing and the things that you are thinking about for your baby is going to produce a God, right? How to give birth to a God is where I got that from. But the point that I'm getting to is that if any of you sisters are any type of sports fan, if you watch Serena Williams when she first started playing professional tennis, or you watched her sister Venus, or you watched Simone Biles or one of the other gymnasts, see, these people live their lives in front of us, and so we can watch them over time. These are highly skilled, highly functional athletes whose metabolism is higher than most people we know. And you watch them over their career gain weight. So you as a mother, you're aging, you had a baby, it might not be good for you to get back to the weight that you were before you had that baby. I can't tell you can or you don't. I have seen women lose all their weight. My ex-wife gained 50 to 80 pounds in both of her pregnancies, and she breastfed, and when she stopped breastfeeding, she was back down to her pre-pregnancy weight. But I've seen many, many women do everything right, have a goal to get back to their prior pregnancy weight and couldn't get there. They were 10 pounds over, 15 pounds over, but everything was okay. And that's what I tell people when we talk about weight loss or when people want to get to a certain weight up or down. You can't always use, not even yourself in the past as a standard because the body is changing. At the same time, a woman's body goes through a pregnancy and all that work is being done, it's maturing as well. It has to mature. You don't necessarily know that that is the right thing for you to do. So my suggestion would be that we put the thought process into what needs to happen, do the right activity, and be comfortable with where you land. Because what I have seen in not only women that plan on having more children, but also people in weight loss, is that if they set a goal, if they set a goal and then don't reach it, it starts to cause a lot of anxiety, frustration, and all these other things that then start the emotional eating and all these things that start to happen because I don't have a clear, I would say, I'm not happy with the way this journey is going because I had a different thought. But that to me is more important. The status of your child and the fact that you're doing the right things is more important than exactly where you weigh. Because a woman's body, we could probably sit here and talk for 4 hours about all the things that a woman's body does in pregnancy, right? And so that 2 years that it takes from the Quranic perspective, in my studies, all of the body aspects are being I wouldn't say repair because that's not the right word. It's actually being renewed, almost like it was before she got pregnant. And that in the studies that I've read, it's approximately a 2-year process. where this woman's body gets her ligaments and tendons in the pelvic area back, gets her different organs that were moved out of the way from the size of the baby growing back to their optimal functioning. And then not excusing the fact that this mother, after 2 years of breastfeeding this baby, there are many things that the breastfeeding did to improve her. But then there's the factor of that being disjointed, right? Because we all can talk about the difficulty factor of a child being weaned from a breast. But what about the mother and all the things that were going on in her? That was a benefit that she was giving life to this child. So there's so many factors. I think sometimes if we concentrate on the weight, it might be the thing that we need to let go, and everything is going to go exactly the way it's supposed to go if all these other factors are being done to the best of your ability.
Now, I will say that, while the challenge is that that is true, and yet we also know that Master Fard Muhammad said, "Do not let me catch any sister other than herself in terms of living a life and weighing properly." And we also know from, the Honorable Minister Louis Farrakhan that, Mother Clara Muhammad, the Savior, told her, to maintain herself at a certain weight, and she was obedient and would fast until she got herself back to that weight. So there's, what might be applicable for your situation might be different at different times, because you might have a time period that you have to overcome whatever, mental or emotional barriers to get to where you're trying to go. But if we are really coming directly from the teachings and using that as our central, I guess, North Star, or guiding posts, we should still be trying to get back to um, a weight that is consistent with what it I would say was. I am somebody who will, rather than compare you to other people, many times I will ask women, okay, how much did you weigh when you were 30 or 25? Because, it kind of takes everybody else off of it, and then just focus on yourself. So, we might be different things for different times, but if we're honest, what we're told is that our weight is important, you know, and we sometimes we can overemphasize it, but that is that is actually part of our teachings.
Yes, ma'am. Thank you. I do remember, and I know Dr. Akili is going to find the page number. I do remember in How to Eat to Live, because once I got pregnant, I was looking for reasons to eat more than one meal a day. I ain't gonna hold you. So like I need to know exactly how many meals I can eat. And I got the letter from my sister Catherine, sent me the letter from the messenger for women going on maternity leave. And he said, at least in the pregnancy stage, at least 2 meals a day for that stage. And then in the How to Eat to Live, for breastfeeding sisters, he said to eat 2 meals a day while breastfeeding. So gotta feed yourself and gotta feed the baby. Like myself, I'm still breastfeeding. He's about 15 months, and he breastfeeds like he's still a newborn because he won't eat food. So having, like Sister Safiyya, Dr. Safiyya was discussing, that breastfeeding stage, your appetite is ferocious, but you may also not have the time to be eating. But we do have to maintain that 2 meals so we are not falling off the bone. In my experience, the weight loss was not necessarily from health for me. It was specifically because I wasn't eating the way I was supposed to eat as it pertains to me breastfeeding a child. So the weight dropped drastically. as opposed to it being like maintaining a healthy type of weight postpartum. So, Dr.
Well,
Akili.
let me
Right.
give you the
As
quote.
women, we're literally laying our life on the line
On the
when it comes
line.
to death's door each and every time, and I think really having that appreciation, say Allah hates ingratitude. And I think, any of us sisters who has gone through that experience, understand it in a way that um really as a society, we have to honor it more because you really are risking your life um, to bear children. So,
Yes, ma'am.
All right, y'all ready?
Yes, sir.
Page 90, book 2.
Mhm.
I'm going to start where he starts talking about it. That's at the first full paragraph. Eat good food so that you will be able to give your baby good, pure milk. You can drink cow's milk. Your own milk glands will put it into the right stage for your child. Be careful as to what kind of drugs you take while nursing your baby, and do not take fasts while you are breastfeeding an infant or even while you are pregnant. If you like, you may eat once a day while pregnant or breastfeeding your baby, but you are not forced to do so. You should not go for 2 or 3 days without eating.
Can you go to that last sentence? Can you say that?
If you like, you may eat a day while pregnant or breastfeeding your baby, but you are not forced to do so. You should not go for 2 or 3 days without eating. So that's the statement that I know of that he makes about
so
pregnancy
that
and
means you
breastfeeding.
can you can eat one meal a day. You don't have to.
Mhm.
Don't fast for multiple days.
So I
Absolutely.
guess how would a sister know what would be the temperature check or the symptom of you don't need to be doing one meal? Because if it's not a force to do one meal, and in another part of the book, he says for breastfeeding, when you're breastfeeding, to do 2 meals, but one meal you can do. What
Mhm.
is the distance between?
Like, are you maintaining your milk supply, for instance? Which
Mm,
again, so much of this goes back to stress. And, I personally experienced a lot of these things. I was in medical school when I had my first child. And
mm,
I remember, you know, one time in particular where I had a big test to study for, and my milk supply had dropped. And once that test was over, it was like, you know, it was it increased. It really I was because I had to do a lot of pumping and things like that in between class, and I could quantify, I could see how much I was producing, and it was like a dramatic improvement after
mm,
I'd you know finished with that big stressful thing. And really I always was worried that I wasn't producing enough milk because I was never someone that was able to, have these stockpiles and stockpiles. But, it's
mm,
amazing how whatever it is was enough for my child. He was never a
mm,
scrawny baby. He was a big baby and was able to get enough. But I am certain that, the conditions that I was feeding him under, which were, naturally stressful, um, were impacted, his the at least the total quantity of milk that was
mm.
being produced. Yet somehow, Allah made it so that is enough. So, and I think
That's
that's
good.
part of the reason why those like mother's milk tea, even the process of just drinking a cup of tea and relaxing, before sitting down to nurse or to pump, even that in and of itself, maybe more so than what was in the tea,
Mm,
helped.
that's real.
Only thing I would add is, I've had many breastfeeding mothers that I've worked with, and some of them will say, as I'm breastfeeding my child, my stomach is grumbling. You know what I mean? So I think the one thing that I always just have a conversation is like, I know many times I'll be at the office or I'm doing work and I'm not even thinking about food. But
Mm,
if I hear somebody say something or I see a commercial come up or, driving down the highway, wasn't thinking about food at all. And as soon as you see some sign. So, as long as that is not the lead,
Right.
I
And you
think
shouldn't be
that a
gaining. If
mother,
you're gaining, then
right. So I think
you
a
take too
pregnant
much.
mother or a breastfeeding mother, they know when it's real hunger. You know what I mean? And to me,
mm,
that I think there is I have to find the other statement, but the 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 necessity of a woman to eat in that condition is so important because a woman will start to deteriorate her own body to keep that child alive.
absolutely.
You know what I mean? And if a woman is not paying enough attention to herself, she could literally get herself in trouble as she is making this baby look better and better and better. But I
Yes.
think that is something that every woman has to do for herself is prior to pregnancy, start to monitor yourself. When are you really hungry? And when are you eating because you smell food or somebody offered you food? The Honorable Elijah Muhammad mentions that. I'll find that page as well about do we have the ability to turn down food when it's offered?
Mm.
And that is something that many
No, sir,
people
beloved.
in, especially, right, especially in this society, most of us don't even know what that's like because there's offering of food every day, all day. If you turn on the television, turn on the computer, you're on your phone, social media,
Mhm.
there's food everywhere. So it's very difficult. And again, it just adds to the responsibility of a wonderful mother to be looking at herself and for all the men that are on this call, whether you're have a young wife that's still planning on having children or those that are not married, this is also a reason why we have to be so serious as a husband that has a wife that is pregnant to do
Mhm.
the best you can to take as much burden off of her as you can. So even though this is the sister show, those of us that are watching that are brothers have to understand that and try to have that conversation when we hear brothers talk stupid. And I think y'all know what I'm talking about.
Very good. Very good. Thank you. Um, darling, can you please give me some shea butter? My lips are dry. Thank you. Hey, this is a real show. Okay, we have real life things going on.
Can't get no realer than that.
Like they're dry. I'm drinking this water. It ain't watering. Okay, so maybe I need a pinch of salt first, like Dr. Akili told us last week.
That's
Uh,
one thing I got from you, Dr. Akili, for Ramadan, and I never, I don't know why it never occurred to me, but it really makes such a huge difference to add a little electrolyte with a little pinch of salt.
it
Now, if you add
does.
too much, and you're gonna be going to the bathroom, and that's gonna like you be getting a colon cleanse and losing some of your fluids.
But let me
Like,
go ahead and give the true acknowledgement. I got that from my father, who read the book "The Body's Many Cries for Water" by Dr. Batman Geldy. And
Mm.
so my father, I actually rolled up in the house one day and he was putting salt in his water. I was like, nigga, what you doing, man? Long before the nation, right? So I was like, man, what are you doing? He said, I read this book, bro. You got to check it out. And that's when I started doing it. I started doing it because he told me, but then I read the book. Amazing story. We don't have time for that today, but we'll get to it one of these days.
Wonderful, wonderful.
All that to say, I can't take no credit for that. Praise be to
Yes,
Allah.
sir. Yes, sir. We give credit where credit's due.
right.
We're gonna make while we're talking about pregnancy, we're gonna make a turn into a topic that many sisters are like, yeah, pregnancy is good, but how do I stop this show? How do I stop getting pregnant without the use of birth control pills, um, things of that nature? Sister Callie did give me, Sister Callie, for those who may not be familiar with her, she was the companion, the travel companion of Mother Tanetta. She gave me a couple tea on some things. But from y'all, Dr. Akili's sister, Dr. Safiyya, they don't want to take birth control. They don't want the IUDs. Sometimes it ain't even working, or it has so many side effects to it. How are
Um,
we
I
not
was
getting pregnant?
I was told, and I didn't hear this myself. I was told, years ago, with Sister Captain Amina Russell, that's between you and your doctor. But there are also sisters who, if the brothers don't want to do it, but you could use condoms, because guess what? Interruption method or those are all methods, but you have to ask yourself, how upset are you going to be if that doesn't work, because they're not considered reliable. So, um, that's between you and your doctor and your husband.
Sufficient?
Brother Akili's gonna stay out the class, but he is gonna read what the Honorable Elijah Muhammad said. Page 83 in book 1. The Honorable Elijah Muhammad says, and you already mentioned it, so I know we know this, but the birth control law the enemy is preparing for you with the aid of their angels, the blind, deaf, and dumb black preachers and ignorant black politicians, is not concerned about your future. The white priest knows what these plans will do for you. They know that Christianity has been exposed to the civilized world as nothing less than bait to enslave the black people of the earth, the original people who served the white race as slaves. He offers you death and appeal for your future generations of children. Now, I'm going to stay out the class, but I'm going to mention what I remember the minister saying. I don't remember the lecture, but he talked about some of the information that he was exposed to where some of the condoms were tainted with things that could interrupt and interfere with pregnancy and interfere with a woman's biology to some degree. And the Honorable Elijah Muhammad mentions in Message to the Black Man, I don't have the page, but he said, if you have 1,000 children, Allah would be happy with you. Something to, I'm paraphrasing, but no, but I'm not saying those things to belittle the question. I think the question is extremely important. I, as a physician, before I even got registered in the Nation of Islam, had gotten away from all birth control except IUDs that didn't have any hormones in them, right? So I was doing that. I had a lot of success, but I have never gotten an answer on whether the Honorable Elijah Muhammad or the minister has ever said anything about an IUD. And that's why I'm just going to bow out because,
Right.
you
And
know,
I feel
that
like
to
I
me
did
is a
the
MGT
minister.
class.
I feel like the minister did talk about like planning your families and, putting some space, and, some of these things are uh family decisions. But I mean, honestly, the easiest thing to do that would be the least amount of chemicals possible that's reversible uh is condoms. The easiest permanent thing to do is vasectomy. The easiest reversible thing you don't have to think about is IUD. The all natural, like coitus interruptus or rhythm method, they are methods with some level of effectiveness, but not particularly effective. That's probably how most of us got here. Because that you have to think about hormonally, right? If you are ovulating and most fertile, that would be when your drive to um, mate would be highest. So that is when you're supposed to have the highest amount of discipline to either avoid, um, that activity or interrupt it. It's just not reliable, but it is a method. So.
I've also heard of the black seed oils and, excuse me, not the black seed oil. The what's that other one?
Wild
What
yam.
was it? Neem? Yeah, the neem oil. And Sister Callie mentioned to me, what is that? I think it's an ugly fruit. It has all those little black seeds inside.
Papaya.
Papaya. Yes. She was talking about the seeds of the papaya, that they would take like a handful of those or something like that. I'll ask her again and get specifics on it because that conversation was it was
Right.
a
Like
little
I
bit
said,
before I got pregnant.
I can't offer anything in that regard, and I think you have to ask yourself as an individual, how upset would you be if that did not work?
Facts. What advice do you have for women plan? Oh, the time is 7:32.
Mm.
Ciao. Let me see if I can find one simple question and then we'll begin closing out. The time goes by so fast, family. Let's see. Because I'm trying to cover all bases. We covered hormonal acne, we covered pregnancy, we covered non-pregnancy, um, we covered weight, or I'll say we touched on because these things are so complex anyway. We
Go
touched
ahead with
on
the question
certain
you were about to
things.
ask since you were in the middle of asking. We'll handle that one. If you wish, you in control, my sister.
I'll ask this one. I'll ask this one because I feel like this other one could go down such a rabbit hole. Um, yeah, yeah. Um, what are some ways to reduce severe anxiety without the need for medication? And we'll end off with that one. Anxiety is very real in our community, is very real in the world, which is why we've been given the refuge prayer of seeking refuge from first anxiety, because we are anxious people. It's so much going on. We're very anxious. We're very worried about the future, and we're suffering from anxiety. And we don't want to take medication. So, how do we do this without the use of medication?
Well, I mean, I almost would have to presume people have tried to max out. And see, when you say severe, that's something that, I think about that term because different, there's levels to everything, and it depends on how debilitating the symptoms are and how effective the things that people have tried are. But of course, prayer, meditation, proper sleep, um, auditing, or other types of therapy, cognitive behavioral therapy. Um, which I mean, I don't know, some people might not consider herbals medications, but there's still some type of biochemical effect that you're trying to get if you're taking an herb. Some people have tried kava. That's, at least in Pennsylvania, that's one of the 23 approved uses for, medical marijuana, which is supposed to be the CBD component that helps with that, which at least in
Mm,
Pennsylvania, you could get that, let's say from a Whole Foods, not a, yeah, I think Whole Foods or like a regular
mm,
store, and it's like from hemp, I believe. And some people found that effective. But again, to me, that's still some biochemical intervention, I think a lot of it is stress management. Sometimes people have physiological things underlying, but like I said, I use all available interventions, and to me, I'm
mm,
looking at as well at how debilitating it is, and there might be different interventions we use for different times and levels and all of that. So it would vary for an individual, for like blanket advice. Not all of these things that are going to work for everyone, and it may work well enough, or it may not. But I'm not someone who would say if your symptoms are interfering with your ability to work or take care of yourself or your family or do the things that you need to do, and you've already done all of those things and they haven't worked for you, I'm not someone who would say, well, just keep going living your life like that, when I've seen people improve to some degree, maybe not completely, um with medication. And then there are things like TMS, for instance, that are medical interventions that are not
mm,
medication, TMS is transcranial magnetic stimulation, which is I guess, a type of energy therapy that is like it's like this machine, and it's like stimulating your brain. And I've seen home devices like that, that's, I think, supposed to do a similar effect. But you have anything to add, Dr. Keeling?
Yeah, so I will go back to similar to the weight loss thing. The first thing that I think every person has to evaluate is taking some time and trying to figure out the source of your anxiety, because there are different aspects of why you could be anxious. And so that's a long conversation. So I'm going to just leave that there. We can work on that or talk on that another time, but I'm going to start talking about some things that I would add to what Sister Safiyya said, and that is exercise has been proven in many, 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 many studies as being one of the greatest things that you can do to relieve the body of the physical effects of anxiety.
And
All right, so
depression.
now we have to understand that I'm talking about things to do after we have worked on why are you anxious.
Right.
I do Reiki therapy about 3 or 4 times a week. I exercise outside. When I finish, I take my shoes and my socks off. I put my feet on the grass, and I go through an 8-minute Reiki therapy where I'm just putting my hand in certain parts of my body and leaving them there for a few seconds while I'm looking at this beautiful scenery that Allah has blessed me with in my backyard. All these trees, all of this Georgia backwoods stuff in my backyard, right?
Right.
But to me, Allah has told us in the Quran and the Bible that what He has put in this earth, on this earth, is to serve us.
Right.
And we have to trust and believe that these mountains and these clouds and these trees and these animals and the sounds of birds and the blowing of the wind where you're smelling the aromatherapy, natural Allah aromatherapy, not something you plug in inside your house. So to me, one of the big things that I do, because believe me, being a physician can be anxious as hell sometimes, right? And I will say that altering what you do based on what you believe decreases anxiety. Because I used to be anxious as hell when I was a physician that was prescribing medications and all the general stuff that I used to do. But when I changed and started using How to Eat to Live, and then I saw some so-called miracles, that's what other people called it, miracles. I knew I was just watching God's ability. Then that totally decreased my anxiety. Why? Because I know I'm giving you the answer. And if you decide not to do it, I'm not going to stress about that. But the truth is, I do stress about it because I'm worried about you because you ain't listening, you hard at it, or you think I don't know what I'm talking about, or your faith is not, we're not equal in faith, right? Not putting anybody down, but it was talking about the things that bother me. Man, you could have solved that problem if you see what I mean? So that brings me some stress. So those are the things I do. I work out outside in the sun. I try to keep moving, even like I was talking about last week in my old office in Houston. My office was on the second floor, but I used to walk up and down the steps every day just to move. Right? I could have called somebody on the little speakerphone. Hey, can you bring me this? Or what about this? I would walk down. So all of us can do something. But when you get to the point and you use the word debilitating, or somebody used the word debilitating.
I did.
Debilitating is a different animal. Because if a person is anxious or depressed enough where it's debilitating, then we're talking about sometimes they don't even have the ability to put the energy into what you're suggesting. And so I think that's another thing that we have to talk about is that as you increase in the severity of anxiety and depression, we're talking about people that get to places that sometimes only Allah can intervene and bring them to a place where you can help them. And so I'll finish with this. Brothers and sisters, we have been taught that we have been tricked in language. And the word anxiety and the word depression are tricks of language because we are responding to a system that is primarily about money. It's not about you. It's not about your health. It's not about you improving. And I'm not talking about somebody like Sister Dr. Safiyya. I'm not talking about a person. I'm talking about the system. The Rockefellers made this system about money. Anxiety and depression are normal aspects of life. My mother is sick right now. My mother is going towards death. If I got a call right now and somebody says, or my brother or my sister called me from California and say, hey, Keely, we got bad news for you, man. Mom just passed. Would you expect me to smile? Would you expect me to be laughing?
Right.
And after got that news, you would think I was crazy.
Right.
But if I told you all, somebody just, hey, I just got a text. Somebody about to give me $500,000 for this project that I'm trying to build, my healing center. Would you expect me to be sad? No, come on now. When we get bad news, your countenance is supposed to take a dip. When you get good news, your countenance is supposed to rise. And what we're really dealing with is a person that has always been disconnected from not only in tune with where they're going, but things to do in the early phases of what is happening. And that is a problem in our community because so much is going wrong. Like you just finished saying, Sister Nisa, we're confronted with so much. We think that we're going to be able to solve all these problems with one magic scratch off. I'm going to get this talent show and become a rapper. I'm going to be like Lil Wayne in 5 months. We got inappropriate answers to the problems that Allah put in us to gauge us, right? Anxiety is to get you to say, okay, how do I listen? How am I listening to the communication that's already here? When I'm depressed, how do I find the answer that has already been talking to me? But most of us have been so disconnected from reality that we're not even paying attention to ourselves. I ask people all the time when they come in the office, hey, you remember what you had for dinner Sunday? Literally on a Tuesday. Like, damn, I don't remember. Too much going on. You see what I'm saying? So if we don't slow down, I think everybody, no matter what you do to help yourself and no matter where you think you are from a perspective of mental health in a world like we're living in right now, and then if we say that we are truly, so if there's anybody here that's not in the Nation of Islam, this is not to put you down because you could be right associated with what I'm about to say. But we as members of the Nation of Islam believe we associated ourselves with men that have the hardest job in the history of the world. And if you don't know, this earth that we are on right now and the reality of it is 66 trillion years old. And Black people have been on it all that time. So we believe that we have the hardest job. What is our job? To help raise our people from the condition that they are in back to the condition of people that were building pyramids and putting Olmec heads all over this world, and still can't nobody figure out how we did that. And then our enemies have lied to us and said that they were the ones that came over here and America's theirs. I'm not going to get off track. My point is that we have to slow down and realize that Black people are in trouble. Black people don't have any grip on how to control what they see. This is where they put it, this administration and what they're doing. Well, hell, we were in trouble long before this administration. And if you all keep thinking that an administration is going to help Black people, you're going to keep getting disappointed. So my point is that I look at a video of Palestinians every day just to remind myself how good I have it at this moment. But I also look at those pictures of what's going on in Palestine, and I know that that's a visual of what's been done to Black people's minds. And if your mind has been destroyed that badly, your great-great-great-grandmother, your great-great-great-grandfather, both of my grandfathers were sharecroppers, so it's not too far for me to reach back to a slave. No ability to deal with their anxiety, no ability to deal with the depression, no ability to make their own decisions sometimes, but the fact that their hand was in dirt or on trees, and sometimes they were walking around barefooted, it was just that by itself that sometimes gave them some balance. We have to slow down. Everybody has to slow down in a world like this where everything is moving so fast and you running after a dollar as it loses the ability to get you what you want, but yet you still keep running after that dollar and stop putting all these other things in place. All of us, I'm not going to talk about anybody else. Brother Akili need to pray more. I'm working on it, right? When my alarm goes off, to hell with whatever I'm doing. Unless I'm in the middle of a medical visit, I'm stopping and I'm going to try to pray, or I'm going to beat myself up for the rest of the day. But when I go to the prayer, when I stop and say the refuge prayer, it literally relieves me.
It's a fact.
And sometimes it's hours. Sometimes I'm sitting trying to think of a way to help people in serious medical problems. When I get on my prayer rug and come back and sit at this computer, man, it's like ideas. It's like all the answers just come right to me. So the reality is, brothers and sisters, that for me, I'm not going to speak to anybody else. I'm just offering you what I try. Many times, my anxiety is because I'm not relying on the man that could get me through everything that I'm going through. Why the hell would I need him if I could figure everything out? They call me Master Akili Muhammad. I ain't nowhere near that. My life shows that and proves that. So my suggestion, slow down and interact with Allah. If that's just walking down the street and looking at some trees, smelling some good air. If it's hot as hell like it is in Georgia right now, go a little earlier in the day. But even the sun can give you something. Stay in it for a little while. You don't have to stay till you get hot as hell. You don't have to stay like I do out there till I start sweating like crazy, and then I come back in. But we all have to do something because the total earth, the water, the mountains, the smells, the flowers, the bees, the birds, the sounds of nature, the sounds of animals, all of these things are purposely put on this earth to interact with us. And if we always throw that away and stay inside and get anxious and put on a television program, or get anxious and go to the refrigerator, or get anxious and go to the jar of your liked things, you're taking yourself down a direction that there will never be an end to it, because those things are temporary influences, but they don't fix anything. So most importantly, reach out to somebody, because if you don't know how to handle it yourself, let's, as a Black community, start to agree that we try to do too much by ourselves. And I'm speaking as a Black man to Black men right now, just real quick on the sister show. I am working on myself to stop being the person that I produced Akili into because of nigga activity. Because I started to put myself in environments and put myself around people where I couldn't be the laugh, giggle, jokey Akili. I had to be somebody different. And here it is 30, 40 years later, I'm still trying to undo that stuff. But I'm willing to be vulnerable around Black men because I'm trying it. I'm trying to be a more free about walking around like I'm tough all the time, or hard all the time, or I've got it all the time. Damn it, I don't. Sometimes I'm so goddamn worried about getting to tomorrow. I'm worried about when my wife come home and is she gonna be happy? How was her day? Did I do something around here to put a smile on her face? Right?
You mentioned
So at the end of
something.
the day, brothers and sisters, I'm saying that many of us are anxious because we're trying to do it by ourselves. We got to put Allah back in the mix and then be vulnerable enough to try somebody. If you say out of your mouth, I can't trust nobody, you're the problem. Trust somebody. Try it. If they offend you, then do what the hell you got to do. But at the end of the day, more than likely, you will be surprised that that person will probably help you, and you'll build a better relationship, and they'll probably give you some information that would at least let you get to another moment or another day. And then you'll start to put those things together about what works and what doesn't, because now you're getting outside influence. That's why Allah made us a community. Inshallah.
One of the things that you said, that the Honorable Minister Farrakhan said back in, I think this was like 2013, I put when he was doing the Twitter Ask Farrakhan questions, and I'd asked the question about whether, like why did the Honorable Elijah Muhammad want a hospital, and is there any use for um, doctors or physicians in the hereafter? And he said something to the effect, and I could go back to, I have like screenshotted in my phone where all disease, mental and physical, is caused by rebellion.
That's
And
right.
um, there's different levels to it, like I said, but that's one of the things you mentioned, Dr. Keeley. Sometimes we create these conditions that naturally are going to lead to anxiety. We don't manage our time, we don't manage our money, we don't manage our relationships. And then the natural consequences of those things are anxiety provoking. That's not 100%. There are people who have anxiety attacks or panic disorder, and there's not anything in particular, but a lot of it
Mhm.
is stuff that we could avoid if we, were better at managing our time, money, and relationships.
Great,
Go,
Victoria.
if anybody needs more help and you want it directly from the man of God in our midst, go check out Love and Duty.
Yeah.
That is one of the greatest lectures, one of the most listened to lectures that I've done. But as Sister said, it helped me put in the proper perspective my duty to my wife, my duty to my children, my duty to my patients. And I'll be brief. When I was a drinker,
Mm,
and I would come to my office on a Monday morning or a Friday morning, and I was hanging over, and somebody was asking me to help them with alcoholism, that put stress on me. When I had smoked some weed last night and come to the office and somebody said, I want you to help me get over this drug
mm,
problem, that caused anxiety in me. The minister is the man that made me start questioning, why the hell are you still doing these things as a 30-year-old black man?
mm,
And that made me realize that the anxiety that I had as a physician was because I wasn't living up to the standard that God put on me when He blessed me to be a physician. And so I'm
mm,
just using that as a small example that all of us should evaluate our life like that. If you're married, brother, and you have anxiety, go listen to Love and Duty. Sisters, if you have anxiety about your husband, listen to Love and Duty because he's going to paint out the whole picture.
mm,
And as he said, the presentation of an FOI and an MGT by the Honorable Elijah Muhammad or the minister is the not typical, but it is the standard. And most of us are looking up at the standard and striving
mm,
to it. So if you put yourself in a proper perspective, then you shouldn't be anxious at the fact that you need to make some improvement. Hell, that's what we
mm,
do. Self-improvement is the basis for community development. So some of this, we have to take burdens off of ourselves that we put on ourselves, that you are the perfect FOI. You a damn lie. The minister is the perfect FOI. Keep working at it, partner. Sister, you ain't the perfect MGT. Maybe Mother Khadija is a good example, but you need to be working at it too. But all of us can take a little bit of the fluff away, be more
mhm,
real when you look in the mirror. That's what's helping me, right? Because at a certain point in my life, people talking about how great I was becoming a doctor, I never looked at it like that. But it
mm,
did get to my damn head. Oh, you a doctor? It wasn't that big of a deal to me. After 1,000 people said, you start lifting your head up a little higher. I had to
mm.
kill that because this is just what Allah put me on the planet to do. Hell, if the trash man don't come, my street gonna be horrible. So what it make a difference if I'm a doctor when the trash need to be taken out?
Right.
Put myself right back where I need to be, and that's to take all this crap off. Ain't nobody gonna tell me I'm Mr. How to Eat to Live. Hell no. The Honorable Muhammad, you can put that on him. You can put that on Master Father Muhammad if you want to, but Dr. Akili is still struggling to get it right and still working on it, still reading the book, read, trying to finish book one today, still finding new pages. Don't know where they
Mm,
came from. So at the end of the day, that's how Brother Achilles working on his anxiety to put me in the proper perspective of myself and put Allah in the front all the time. Then I can just throw my hands up and say, I surrender. I'm attempting to submit.
Great, Victoria. Thank y'all. This was I know y'all see the chat in flames. Thank you guys so not you guys. Mommy, you know Sister Brenda would have my head if she heard me say that. Thank you to beloved brother and sister, believers in God, for coming to the Master Call today. Thank you all so much who have participated in this call. We've upwards 60 in here, and this has been absolutely beautiful. It feels like the old times, like yeah, like we've been here for 20 years. It feels like the old days in Master Call history when we would have 200, 300, 100, 150 on the Master Call. Thank Allah that we've been able to go 5 years strong and that we still remain relevant and that we're still able to give not give, what's the word I'm looking for, we're still able to be a space, an open space to offer to the people what has been offered to us, to extend the truth that has been extended to us through our leader and teacher in God, the Honorable Minister Louis Farrakhan.
May
So
I say
I
something
will
real quick,
hand
please?
this.
May I say something real quick? I just want to say thank you again to you,
Thank you,
Sister
Tori.
Anissa, and you, Brother Demetrius, because as I said last week, I've always admired you all from afar because what you're doing to me is so essential to us being good Muslims, but also letting every other person that comes in here that's not a member of the Nation of Islam, we just real people just like you. This is just our choice, right? And at the end of the day, I always appreciate the fact that you and Brother Demetrius are straight comedy sometimes. So I like that part too, just being real. We ain't got to be crack soldiers all the damn time.
Yes, sir. Thank you so much. Thank you so much.
Thank you for the invitation and for your consistency in
So,
this program for 5 years.
praise you to Allah. Thank you all so much. I'll pass it over to Brother Demetrius. My baby is crying in the background, so mommy has mommy duties. Brother Demetrius, you can unspotlight me. So
Yes,
I'll
ma'am.
pass it over to Brother Demetrius. Please, everybody, don't leave all at once. A family that prays together stays together. We started in prayer. We will end in prayer.
Praise be to Allah. I'll just throw out a thanks as well to Sister Anissa for starting the master call for anybody who didn't know. And now I have the difficult task of doing these announcements because it's hard for me to even speak after what you both just gave us. There's so much to digest. Sister Dr. Safiyya, it's been a pleasure just seeing your face on our platform this whole time. Thank you so much for joining us, and of course you as well, Brother Dr. Akili. This is you guys. I'm gonna take that away too, since Sister Nisa brought that up. Not you guys. This is both of your home. So consider this platform yours to share what Allah is feeding your minds with. If you ever want to come back, just reach out to us. I do want to say I very thoroughly enjoyed seeing the harmony of both of you all's expertise and your passions. And that's something that, as a young brother in the nation, I very much admire about our nation, and that I admired watching between the both of you, particularly, and sharing your thoughts and your experience so beautifully together. Even if there were different opinions at different times, we have to be able to come together to put our minds together like that. And I think you guys did an excellent job of showing that. So quick announcements. I did just want to throw this out there. Sister Nisa gave a Black business shout out earlier, so I said, I'm gonna just sneak my sister in here real quick. Shout out to our sister Tasha Muhammad, who has her herbal store. She's in the audience right now. Registered MGT, and I wouldn't do this just because I know her, but I'm doing it because her stuff actually works, and I'm like, wow, this stuff is really working with what people are coming to her for. So, if you need some good herbal goods, it's healthybody.42 on Instagram. I just put it in the chat. And you could go to that link to, connect with our sister and let her know what you need. So with that being said, thank you both for your time. We did go a little past the usual time. So I thank you, Sister Dr. Safiyya and Brother Dr. Akili, for allowing us to have a little bit overtime with that last question. And thank you for both of your passionate answers. If any of you would like to share with the family your contact information, as far as if anybody would like to get services from you or how to reach out and support your business. And we'll start with you, Sister Dr. Safiyya, if you want to share any contact information, as well as, because we always do this, your Cash App or Zelle or whatever, if somebody would like to make a donation, because I'm gonna be straightforward with y'all. This type of stuff that we just had on this call, this should have been charged. We just being real. But the messenger didn't charge us to get this information. The guy didn't charge us to get this information from him, so we give it to you free. But charity is a pillar of our faith. So if either of you could drop that information, we'll start with you, Sister Dr. Safiyya. Anything contact information.
Okay, and I guess I can what I'll do is find a link that I could post the link, but I have a hybrid practice that includes direct primary care, and I do have telehealth only options. It's in that membership model. I'm licensed in Pennsylvania, New Jersey, New York, and Illinois currently, and may add some additional states. So you can go to fountainmedonline.com and follow the link to direct primary care to learn more about it, and I'll navigate to my own page um, to drop that link in the chat to make it
Yes,
easier
ma'am.
for people.
Can you pronounce the website one more time, sister?
Sure. I just put it in the chat. Fountain like water fountain, fountain of life, fountain of health, fountainmedonline.com.
Gotcha. Praise be to Allah. And no compulsion, sister. But did you want to drop any cash app info, Zelle info, anything like that? No compulsion.
Listen, I ain't trying to block nobody's blessing. Let me figure out what it is.
Go ahead. Yes,
You know,
ma'am.
like
Yes, ma'am.
uh uh Supreme said, please, he don't like to see people profiteering off the teachings, but I mean, I'm not gonna block
Yes,
nobody's
ma'am.
blessing if if they felt like they wanted to give some charity or whatever. I was telling a sister that actually at just Saturday, how sometimes we get so uncomfortable. We watched it with Dr. Akili. I'm gonna put him on the spot. We watched him reject a compliment where, when you don't receive, you can give, but you have to also learn to receive. And sometimes that's equally important to keeping the flow of energy open so that it doesn't get stopped up. So, yeah,
Yes, ma'am.
I guess I
See,
had to look it up because people don't. I could provide people with thousands of dollars in services, and then they don't be wanting to pay for it. So it's no compulsion. You've already received it, um,
yes,
free of
ma'am.
charge. But hey, I won't block your blessing if you felt so compelled.
Praise be to Allah. Okay, so she just put it in the chat, family, $ Dr. Safiyya, just like it says on her name on screen. And Brother Dr. Akili, how can we reach you? This is also in part one for the family who missed it, but Dr. Akili, how can we reach you?
I put my website in the chat as well. That has my Columbia number and all the information for that. And I put my PayPal in the chat as well if anybody wants to do some charity work. So I appreciate it.
Praise be
Thank
to
you
Allah.
again for the opportunity, and it's always a pleasure to be with my sister. So thank you
Yes,
all for the
indeed.
platform.
All right. Thank
Inshallah,
you.
we help somebody today.
Yes, indeed. And before we close out in prayer, because again, this will be available for replay, that theultimatewellnessgroup.com for Dr. Akili's website, and theultimatewellnessgroup@gmail.com for the PayPal. Last but not least, just to show our flyer, which we forgot to do during part one, so you all know where you can actually come to the master call. This is the flyer for our Tuesday calls. Currently, and let me know if you all can see it. Currently, we're reading the restrictive law of Islam is our success on Tuesdays. Even if you don't call yourself a Muslim, that's all right. Just come on the call and read with us, have the conversation over the reading with us, and I guarantee you it'll make you a better person. So all praise is due to Allah. Thank you all for your time. The audience as well. Thank you. Without further delay, let us close out with prayer. Prayer. In the name of Allah, the Beneficent, the Merciful, all praise is due to Allah, the Lord of the world, the Beneficent, the Merciful, Master of the Day of Judgment in which we now live. Thee alone do we serve, thee alone do we beseech for help. Guide us on the right path, the path of those upon whom thou hast bestowed favors, not of those upon whom wrath is brought down, nor those who go astray after hearing thy teaching. Amen. Love you all. Assalamu alaikum, family.
Assalamu alaikum, family. Thank you so much.
Walaikum salam.
Beautiful. Thank you.
Thank you, Sister
All
Shahida, for covering down.
praise.
Assalamu
Thank
alaikum.
you.
Assalamu alaikum.